Time to catch up with a co-host of Human Cog podcast. They call us Sabina Read. How are you?
They do call her Sabina Read, or at least that's what her parents called her, and I'm well, George. Good to be here.
Next time I want a T-shirt and it's got to go Sabina Read. Do you know when I left Channel 9, a friend of mine, George Negus, gave me a T-shirt and he said, "Not George de Negus." Because for years when we worked together, people couldn't discern the difference between Negus and Denikian. Can you imagine? And they created a hybrid called George de Negus. It was most illuminating. Anyway, by the by, let's talk about more important matters. And one of those things I want to talk about is the state government grant. They've offered up something in the vicinity of $60 million to address some of the mental health challenges that Victorians are experiencing, of course, and feel impacted by through COVID. What do you make of that?
Well, $60 million sounds like a big whack of money to the average Aussie, and the Victorians doing it tough at the moment. However, the status quo of mental health in our country, and particularly in Melbourne and Victoria, is really pretty dismal at the moment. So I read some stats that suggested $60 million equates to $10 per Victorian. That's not a lot of money towards a fundamental requirement of human well-being, and that's attending to our mental health. It's my understanding that about 50% of this $60 million has been allocated to hospital beds and more acute settings. And of course, this is a much needed area of funding. But what it means is that our attention, or at least the funding, is being given to what I would call kind of the pointy end. It's the ambulance down the bottom of the cliff. And I don't want to negate that, but I also would love to see more of an attention on prevention before people get to the point of knocking on a hospital door.
Is the likelihood that the federal government may step in and provide some more money for mental health?
I guess that's possible, but I think this story is bigger than the corona pandemic that we're all dealing with. We've already been told that the system was broken, and that was back in 2018. So this is not just a pandemic story, although of course the pressure points that people are under now has seen anxiety and depression, self-harm and suicide rates skyrocketing. So
Sabina, you're inferring or suggesting to me that we have had a growing problem for quite some time, and this COVID pandemic has come along and pushed it even further down the track. And what was a problem has become a quite significant concern for a great many Australians, not just those of us in Victoria at the moment. So how do we address it? What are the sorts of things we need to learn, one within our families, within our communities, and of course within our business groups as well?
Well, one of the issues we're dealing with at the moment, George, is that a basic building block of well-being and mental health, sound mental health, is connection, and our sense of connection and community and belonging and touch, something as fundamental as touch, is not possible at the moment. So for some people, we were able to keep ourselves buoyant enough, even though we were struggling with certain elements of our lives. But now, without this wraparound of community and connection and family and friendship, that has been such a fundamental building block that's now been lost, or at least eroded, that I think that's having a significant impact on mental health.
I tend to agree. The deprivation of that you feel, just not only to touch someone else, but and we used to do it with a handshake, we used to do it with a hug. We've been denied everything, haven't we?
Yes, touch is something that, from the day we come into the world is important for our survival, and no more important than it is now. So that's one piece that's missing. I think our identity is also often very connected to what we do and how we impact the lives of others, and the meaning that we get from our work. And so for those of us who have lost work, or our hours have been reduced, or we're continually, repeatedly job hunting and facing rejection, then that has also created higher levels of mental illness for people that, again, might have been doing okay, and then this is just too much, has pushed them under.
Now, much of what we're doing at the moment is with things like Zoom, with FaceTime and so on. Are there coping mechanisms that are simple, that we can offer up, that we aren't offering up at the moment to help?
Look, I think that telehealth is working well for some people, but we need to recognise that it doesn't work for everyone. If you're lacking proficiency with IT, or if you don't have appropriate data, or you don't have the equipment, then just saying that everyone is able to access mental health support through telehealth is not a true statement. Something that I've been doing with my clients is walking sessions, and it's something I've actually wanted to do for a long time, and it's taken this pandemic to make me make the change. And I find that works really well. We're able to walk at a appropriate social distance from each other, and yet we still have some kind of contact, and we're moving our bodies, which we know is so fundamental for good.
Is this how you do the Human Cog podcast?
I'm not recording a podcast as I walk. I think I'm good at multitasking, George, but recording a podcast and walking is not something I've tried yet. But hey, now that you've thrown the challenge out, I might give that a go.
Now, you touched on a whole bunch of stuff then that's just so important to each and every one of us. You touched on the fact that some of us are able to cope where others are struggling. Can I just tell you, I've been a media professional. Zoom is not a challenge for me. I actually enjoy it. I understand there are different dynamics at play, and I do the best I can. But I still am getting this feeling of it's Groundhog Day. Each and every day we have a routine, and it doesn't differ too much. You get up, you prepare for what's to come, you dress accordingly, then you go through that rigmarole of cleaning, adjusting, more cleaning, and back again, and that's the same day. It seems to be we're playing this the same day out, week in, week out, and month in, month out. How do I get my head around to try and change things when I'm actually in this cycle and can't break it?
So I think it's important that we don't keep asking when will this be over, because we set ourselves up for failure, and we expect there to be some finish line that continues to move. But the second thing is, in each of our days, I think it's helpful to try and echo what our routine looked like pre this pandemic. And so if your routine used to be that you'd walk to get a coffee, or you'd see certain colleagues, or you'd do a certain commute, although we can't mirror those exactly as they were back pre-COVID, I think the ways that we can bring some of that variety, some of that learning, some of those rituals, to continue to honour them in adjusted ways is a helpful approach. So whether that means exercise, or you might have used to meet someone for a coffee, maybe give them a call and have a coffee over the phone. You might have exercised at the gym's closed. Find a way to still embed that time of exercise at the same time of day into your routine, even though it's going to be in your lounge room instead of a gym. Otherwise, we're sort of throwing the baby out with the bathwater, and the things that created a sense of stability and well-being and safety, continue to find ways to embed them, albeit in new and more creative and innovative ways.
Just before we go, if someone wants to reach out and find the Human Cogs podcast, where would they find it?
It's a really good question, and thank you for asking. So anywhere where you get your podcast, so that's on Apple or Spotify. You can also find us through the Human Cogs website, where there's more information. And basically, these are conversations that we're having with fabulous people who we're calling extraordinary ordinaries. And sometimes when you want to take a break from the COVID story and the onslaught of news updates, it's quite a welcome relief to listen to people's stories and how they've navigated challenges in their own life. And that's what we're doing on Human Cogs.
And what do you make of this phenomenon of podcast? You know, the technology has been around for quite some time, but it seems to me that because many people are now locked down, we have suddenly been we've been thrust into this need to fill some space, and a podcast allows you to do so many things, take in information, but also get on with cleaning the house and other things that you tend to do. Are you finding that?
Yeah, Yes, and it's a low barrier to entry, both for the maker of the podcast, but also for the listener. It's an easy thing to do. As you say, you can walk the dog, you can do the dishes, you can cook, but you're able to choose tailor-made content that interests you. So why not? Most of it's free. It's a new way to learn, to stretch your mind, and that's something super important at this time, George. We are looking to challenge ourselves. We can become very connected and overwhelmed with our own thinking, and to be able to hear other people's stories and open our minds outward is also a healthy approach when we're feeling really physically and sometimes mentally and emotionally stuck in our own worlds.
Thank you for giving us a lift. Sabina Read, our favourite human cog.